Hi, everybody. My name is Amanda Nicklas, and I just wanted to share with you my personal philosophy on nursing and healthcare. So, this is me. I'm Amanda. I've been a nurse for 10 years. I attended university at Seattle Pacific University, and I'm in my second year at Gonzaga to become a nurse educator. And these are my three kids. Caleb is 3 years, almost 4. Hannah is 1.5, and Simon is 7 months. And of course, I shouldn't forget my husband. Of course, with all the kids around, we don't take pictures together too often anymore. And we'll be married 5 years this fall. My family means a lot to me, and while I go to work, I find that my life's calling comes in many forms: my family, my marriage, my vocation, and of course, my faith. Um, but before we can start talking about my philosophy on nursing and healthcare, I just want to talk a little bit about my history because I think who I am forms a lot of what I think about when I look at nursing. I grew up in Spokane. I grew up going to church, and because of that, my faith has always guided my way, guided me towards a Christian university and the continuing of developing my faith. And as my faith develops, so does my philosophy on life and the vocational calling that I have in my day-to-day living. In my nursing career, I left Seattle after I graduated and moved to Texas and worked as a labor and delivery nurse for 2 years before becoming a traveling nurse, which I did for 1 year. But then I just had this sense of a higher purpose and joined the Navy Nurse Corps to serve both those in need of healthcare, but also my country. I find that I am a nurse because I'm called to help others, but my calling as a nurse is intertwined with my faith, and the job that I do daily at work is an expression of the calling that I feel like Jesus told us to do as far as serving other people. And with that, I kind of find that what I do in my nursing career is a revision of the golden rule. The golden rule, of course, being, do unto others as you would have them do unto you. I find that Jesus' command to love one another just as he loved us, which is found in John 13, is more of an indication of what I should be doing with my faith, and thus something that I do in my nursing career. With that, I look at the ethical priorities for me in my job, stemming from the American Nurses Association Code of Ethics. The things that really resonated with me were respect, equality, and freedom. Respect is that I respect each patient where they are, and really I treat each person as I would like to be treated, looking at that golden rule and loving them where they are. In equality, I treat everybody the same, race, gender, age, and when you get into labor and delivery, even the decisions that they make in their healthcare, I'm going to treat the poorest of the poor the same as the CEO of the hospital. I found this especially when I was in the military, when I would be treating enlisted military members as well as admirals. I would treat each of them the same. When you come to the hospital, especially on a cardiac telemetry unit, you're in a really vulnerable state and don't need to be looked down upon because of your lower rank or treated with any extreme preference just because you're an admiral. I would treat all of my patients the same. And that leads me into my healthcare philosophy, in that I think that really the state of health of a person depends on their perspective, and my job is to meet them where they are. I found that you can look at two patients with the same diagnosis, and one person will think that they are sicker than sick and want all kinds of medical interventions to make themselves feel better. And you can look at somebody with the same diagnosis and they'll think that they are perfectly healthy and just want you to give them the one treatment that will make them feel better. My job is not to judge that person, but to meet them where they are. Looking at that in light of my nursing job, currently I'm a labor and delivery nurse, and you really find a wide range on the spectrum of how a person views labor and how they want to deliver their baby. Um, and I really try to provide an unbiased and non judgmental information to those patients so that they can make the informed decisions that they need to have the experience that they want. And that is going to look different for every single person that I deal with every single day that I go to work. Moving forward, I really think that no nurse should be stagnant in their nursing career and should always be looking to the future and where they want to go and how they want to serve their patients. So, as I move towards becoming a nurse educator, I really hope to maintain my desire to help others. And in doing so, hope to provide our next generation of nurses the necessary education that they need to find the passion that they have in caring for other people. So that's my philosophy on nursing in a nutshell. Thank you for listening.